Okay, to your health now. Houston's only TV health reporter, Haley Hernandez, is back with us with a unique way folks are celebrating the Barbie craze. Haley?
Yeah, so I mean, we all have Barbie fever right now. I came dressed in my pink, just paint the town pink. And joining me now is Dr. Edward Lee from Nouveau Plastic Surgery. He says you're not going to believe how Barbie is actually motivating cosmetic procedures too, right? Are people coming in? Like, what are they asking for? Are they being inspired by Barbie?
Absolutely. Since the movie came out, people have been really interested in what Barbie stands for. I mean, for us, we grew up with Barbie, but for the new generation, it's kind of new for them, right? It's a cultural phenomenon for us. So, what Barbie
and the nostalgia too.
Right,
people are just like obsessed with it.
So, what Barbie stands for. I mean, obviously there's different things about that, but people want to look and feel their best, right? And so, whatever they can to enhance their natural look, whether it be surgical or non-surgical, are coming in. So, fillers to enhance your volume of the face, anywhere in the body, non-surgical skin tightening, things to kind of improve your shape. And surgically as well, to enhance your natural curves of the body. So
Yeah,
I've seen that a lot.
So we're referencing Barbie too,
Right.
and as much as Barbie has been an icon, she's also been a source of controversy because of her looks. So do you ever tell people to scale it back, or that they have unrealistic expectations when they come in asking for these things?
Right. The most important thing that we have to establish is that whatever we offer is going to be the right treatment for the patient. So many times we turn patients away saying, that's not the right thing that we should be focusing on, or we would recommend things that would, really be more realistic for that particular patient.
So you do have a variety of options that you can offer somebody that would be good for. I know like skin pigment is sometimes an issue that I kind of worry about too. So I didn't know if that was something you can cater to.
Yes, absolutely. So like lasers are wonderful treatments for pigment issues. But again, it just depends on the patient. So we offer full spectrum of things that we can for each individual patient.
Yeah. So speaking of having unrealistic expectations, sometimes, if you had told me 2 years ago that we would have a weight loss drug that was effective out on the market, I would have thought that was unbelievable, right? But now you're seeing in your office, as well as we're seeing all across Hollywood, that people are just going crazy for Ozempic and other like the semaglutide, the other like weight loss types drugs. I mean, what is that a craze that's going to die down anytime soon? What are you seeing? How do people get it?
No, absolutely. It's incredible how much has changed what we do. This class of drugs were initially developed for diabetes, but as a side effect, you get weight loss, and incredible weight loss, actually. We're seeing 10, 20, 30-pound weight loss in patients. And so yes, I mean, it's going to be here. Unfortunately, from an insurance standpoint, it's covered for diabetic patients. So we're seeing a lot of patients who come in to want it that are not diabetic, and we are offering it for patients. And obviously, it has to be controlled and monitored because it is a medication. However, done right and done in a safe manner, it's an incredible tool that we have.
So insurance won't cover it unless you have some kind of a chronic condition. Otherwise, you're paying a price like you would for like a cosmetic drug or procedure.
$1,000 per weekly treatment. That's kind of what we're looking at.
Oh, wow. Okay. And then when you're on Ozempic, we see a lot of celebrities cutting back on alcohol. Is that a special type of diet that you have to be on?
Actually, it's interesting. So there's studies coming out showing that Ozempic or semaglutide can also suppress the alcohol reward system. And so they're kind of working on it now, but they're seeing that it can help with alcohol-related symptoms.
Alcohol-related symptoms. So that makes sense because I had also read a study about how it's impacting people with just other types of addictions, like gambling addictions and stuff. It's doing something inside of the brain, and I'm not even sure if they know the right answer as to like how they're doing it, but they know that it's tapping on something that's making us have addictive behaviors.
Right. It's incredible what it can do, but we're also seeing the effects of it too. So with all that weight loss, it's kind of back 20 years ago when we had weight loss surgeries. People had lost a lot of weight, had a lot of extra skin and sequelae of that. So we're seeing patients for that now as well. People talk about Ozempic face, Ozempic body, where you have a lot of skin laxity. And so, so it's very interesting how this drug is changing not only our lives, but also what I do as a plastic surgeon.
Yeah. So, but then they're in the right place, right?
Exactly.
They're in a plastic surgeon's office to deal with those other side effects of the weight loss. Very interesting.
Right.
Dr. Lee, thank you so much for coming in and talking to me live.
Thank you for having me here.
I know it's sometimes stressful to do a live interview, and you did an awesome job. I appreciate it. And be sure to go to click2houston.com/scene at 7 if you want to see more. Owen.